Welcome to another episode of Alternatively Speaking from KCSA Podcast Labs. I'm your host, Phil Carlson, along with my co-host, Dan Donahoe. And today we're continuing our discussion on longevity, the science behind it, as well as the entrepreneurs advocating for and funding it. Joining us today is Sebastian Brunemeier, a true powerhouse in the longevity and regenerative medicine space. Sebastian's credentials are as impressive as they are diverse. He's a biotech venture capitalist and company builder with a laser focus on extending human health span. As the co-founder and general partner of Healthspan Capital and the CEO and founder of ImmuneAgeBio, Sebastian is at the forefront of immune system rejuvenation research. His track record speaks volumes. Over the past 5 years, he's co-founded 4 longevity biotech companies with a combined equity value exceeding $600 million. Sebastian was the co-founder and chief investment officer at Cambrian Biopharma, co-founder and COO of Samsara Therapeutics, and principal at Apollo Health Ventures, the world's first and largest aging-focused venture capital fund, managing $200 million in assets. His academic background is equally impressive. Sebastian was a Fulbright Fellow studying the biology of aging, the Skaggs Oxford Scholar at the Scripps Research Institute, and a SENS Foundation Scholar at the Buck Institute for Research on Aging. Sebastian's influence extends beyond his business ventures. He served as a trustee of the British Society for Research on Aging, a mentor at the New York Academy of Sciences, and as an advisor to numerous organizations, including Vita Dow, Equator Therapeutics, and even McKinsey & Company. In today's episode, we'll tap into Sebastian's vast expertise in exploring groundbreaking research in rejuvenating the immune system, the potential of regenerative medicine, and how emerging technologies are reshaping our approach to aging and health. We hope you enjoy.
Sebastian, thank you so much for joining us today. You have a really interesting and rich and deep background in healthcare, life sciences, with a particular focus on longevity. So we do want to get to, specifically some of the companies that you are investing in, some companies that you're interested in. But first, we want to hear your backstory. What brought you to this world of longevity science?
Sure. Yeah, happy to. And thank you for the invitation to the podcast. So yeah, my story, I'm a scientist by training, a longevity scientist. I've been in the field about 10 years, and everything from doing the research in the lab, long nights at the lab bench, to launching companies, both as a founder of companies and as a venture investor, company builder. And my mission is to bring as much capital and talent into this longevity biotech field as possible, because I believe that it is the next evolution of medicine, treating the root cause of disease, targeting aging itself, which drives most diseases today, rather than the symptoms. So most of what the pharmaceutical industry and healthcare industries do is target symptoms of disease late in the process. And I'm a believer that you should intervene early and fix the root cause. And so this is what we're doing in the field of longevity biotech, or long bio, and regenerative medicine.
So, Sebastian, thanks again for coming on here. You wear a few hats. You're a VC investor with Healthspan, CEO of ImmuneAge. You're advising a number of different companies. So we can definitely see why you're invested in longevity here. You're looking for the extra time here to work with all these guys. But just all kidding aside, it's a busy life cycle. Can you talk to us about the challenges and how you make it all work?
Sure. Yeah. A lot of entrepreneurs and people in the venture world, we really love what we do, and it's our passion, it's our whole lives. So to the extent that I can help a lot of different groups, the better. I've been a venture investor, and I've invested in over 30 companies in the longevity space. I think that's technically more than anybody else, even though it's a small field. And I've co-founded 3 longevity biotech companies: Samsara Therapeutics, Cambrian Biopharma, and ImmuneAgeBio. And they're all targeting different elements of the biology of aging. And something that's kind of cool is in the labs all over the world, hundreds of labs, we can extend healthy lifespan across species. We can turn back the clock and rejuvenate animals. And we can even get up to about a 50% lifespan extension in mice. And so even if a little bit of that research translates into humans, I think it's going to be a revolution in medicine. So that's kind of what gives me the motivation to work so hard, even though it's probably not ideal for my own longevity. It's a trade that I'm willing to make.
Well, we're definitely going to get into, what you've learned and how you have changed or not changed, living your life the way you live. But I want to, for now, stick to some of the companies that you are working on. There are so many. Everyone seems to have a different definition of longevity. They're similar, but we're learning through this project here that there are different facets and different kind of threads to pull on. In particular, what are you focused on? Is it immunotherapy, inflammatory, age-related illnesses? Can you just talk a little bit about some of the projects that are exciting you and what exactly field they're in?
For sure, yeah. So we've invested in about 30 companies, or I've invested in 30 companies. Our fund, Healthspan Capital, we're the most active angel investor in the longevity space. And so, basically every element of longevity biotech and regenerative medicine we're interested in. The main area that I'm focused on right now is rejuvenating the immune system. So we saw the importance of immune system aging in COVID, for example. The number one risk factor for COVID was biological age. It wasn't your political party or something like that. And so, that's kind of the sad aspect of it. The positive aspect is that the field of biopharma is undergoing a revolution by harnessing the power of the immune system, immune cells like T cells or NK cells, to treat cancer, to treat autoimmunity, to treat infection, many, many different applications. And so my reasoning was that we should try to rejuvenate the immune system at its source. There's a stem cell type called a hematopoietic stem cell, an HSC, which is in your bone marrow. That's what's transplanted in a bone marrow transplant. And that cell gives rise to all of the immune cell types in the body. And so instead of trying to harness one or two of these immune cell types at a time, like T cells or NK cells, what if we rejuvenated the source of these dozens of different immune cell types that are known? And so that gets back to my philosophical approach to the root cause, or first principles. And so what we do at ImmuneAgeBio is we have a method of expanding the number of these hematopoietic stem cells by over 1,000-fold, which is the world record. This work comes out of Stanford and Oxford with our scientific collaborators. And we got 2 Nature papers for this work. And that alone can be a breakthrough in the bone marrow transplant field, where the number one factor that determines bone marrow transplant success is the number and quality of bone marrow cells that you have to transplant. But we also can use it to find new molecules that rejuvenate the HSCs and rejuvenate immune function, and thereby prevent or treat cancer, infectious disease, and many different diseases of aging, because the immune system travels throughout the whole body and it regulates regeneration and aging systemically. And so when you actually transplant the bone marrow from a young mouse into an old mouse, that mouse can live up to 1/3 longer, extends its lifespan 1/3 longer, which is close to the world record for any therapeutic intervention in the aging field. And that animal is cognitively sharper, physical function is better, resistant to cancer, infection, et cetera. So they really have a bona fide new immune system. It's pretty amazing.
What if is the reverse true? So if you put, old mouse bone marrow into young mouse bone marrow, all of a sudden, like, the young mouse is walking with a cane and...
Yeah, exactly. It is, it's deleterious. And we also have direct genetic evidence. So there was a Nature paper from a colleague of mine who showed that if you mutate a DNA repair factor in the HSCs specifically, it causes systemic aging, accelerated aging, what we call progeria. So there are these rare diseases that are like reverse Benjamin Button diseases.
Oh, I've seen. Yes. Okay.
So it's sufficient. And this is why it was a Nature paper, because it was surprising. it's sufficient to mutate one gene that governs DNA repair in the bone marrow stem cells, the HSCs. It's sufficient to cause systemic accelerated aging. And so that kind of is one of the many lines of evidence for the importance of the HSC and systemic aging. And one of the great things about working on HSCs is that we can take them out of the body, rejuvenate them, and then put them back. You can't do that with most cells in the body.
Just staying on the bone marrow rejuvenation, are you seeing other big pharma plays in this space? The reason why I ask, I just want to know if this is going to be like a leading vertical for the biotech industry going forward.
Yeah, so if we go back 20 years, pharma was not active in cell therapy at all. And today it's one of the hotter areas, T cell therapy, NK cell therapy in particular, Tregs. There are a large number of cell therapies that are on pharma's radar, and some
Right.
multi-billion-dollar acquisitions just recently, including in heart regeneration, quite interestingly. So pharma is actually to some extent neglecting the bone marrow field. It's not really on the radar yet. Just in the same way that T cell therapy or NK cell therapy was not on the radar for so long, even though the scientific evidence in favor of these approaches was known for many decades. So that's the way pharma tends to operate. They get in very late in the game. It's the kind of stuff that academics and biotechs may have been working on for decades before pharma finally comes in. And that's true of most large industries. They rely heavily on startups and VCs to source the innovation, and then they come in later to do marketing and later stage development.
They want the sure thing, right? They want
easier to buy it.
Yeah, exactly. They want you guys to make all the mistakes, and then they'll reap the rewards for their shareholders. Not that we don't love big pharma. We don't love big pharma, but that's a different podcast.
Part of the reason I do what I do is because I agree that big pharma has dropped the ball. Human health has not been improving as much as we would have hoped. I mean, if we go back 50 plus years, if we go back to say 1970, Nixon declared the war on cancer. And the head of the NIH at the time said, within 10 years, we will have cured cancer, right? And they keep making these proclamations. Mm-hmm. There's all these expectations. And Peter Thiel and Tyler Cowen and the Founders Fund sort of community have this technological stagnation hypothesis concept. They say, we were promised flying cars and we got 140 characters. There hasn't been this rapid technological advancement. Yeah, the advancement in technologies has not been as quick as we would have expected going back to, say, the sci-fi days of the 50s or 60s. And something seemed to happen in the 1970s where the pace of progress measurably declined. And this is true across the sciences. And so, yeah, there's something amiss with how the system works presently. And part of it is to do with some fundamental philosophical misunderstanding, shall we say, about the way that the pharmaceutical industry targets disease. Generally, they target symptoms. They target late stage pathology. They don't tend to target the early upstream causal mechanisms of disease. And then it's cartelized. So there's a small number of big pharmas, and so they don't really need to innovate in the same way that, maybe Apple doesn't need to innovate. It just keeps releasing the same product. So that's something that seems to be changing. There seems to be a lot more capital and talent going into the biotech early stage world. And so I predict, in 20 years from now, half of the big pharmas that we recognize will not be as big, and there will be a whole new list of smaller biotechs that became the new big pharmas. So, and I think that's a positive development.
Look, and I guess to just pull on that thread too, the pharmaceutical industry, makes its money off of chronic illness too. And so, if you have that, high blood pressure meds or, that is reoccurring revenue for them. So are you saying that you see a sea change in that happening, and that there won't be this, need for chronic meds, that maybe it's, smaller treatments? I mean, we're seeing it a little bit in the healthcare, in the mental health care space, with things like psychedelic treatments that, are finding, that they're treating things like PTSD where you don't need so many SSRIs and all of this stuff. So are you saying that you think that that's going to contribute to this sea change in the pharmaceutical industry?
Yeah, there's been a lot of discussion about curative therapies or one and done therapies in the context of gene and cell therapy. So over the next couple decades, we're not going to be popping pills or injecting small molecules very much. We're going to be receiving gene and cell therapies and eventually even growing whole organs ex vivo. There was recently an organ transplanted from a pig to a human that was genetically engineered.
That was fascinating.
Yeah, and that wouldn't have been possible without revolution in gene editing technologies like CRISPR to basically make the tissue more compatible with humans. But anyway, so this is a big question in the field, going back to the development of the hepatitis C cures. Gilead and a couple other pharmas developed cocktails of drugs that actually cure hepatitis C, maybe about a decade ago now. And Goldman Sachs came out with this report saying, hey, this curative therapy, curing a disease is so unusual for us that we're going to have to think about some new business model. Because if we've cured all the diseases, we won't make as much money in treating them chronically, which means that we'll have to charge more upfront. And that's kind of the model. And I think it's obviously worth making that trade. That's kind of the model that some of these curative gene therapies are using. So the headline price for some of these gene therapies is in the millions of dollars, but it cures the patient potentially for life. And so there's some payment models that are like a subscription-based fee. So you say, well, some upfront and then some for every year that the disease does not progress. And actually, even though it can cost millions upfront or early on, it saves the healthcare system much more. So, so I think that pharma is actually going to be able to accommodate curative therapies. It's relatively new for them outside of the context of, say, antibiotics, but it's a model that they're getting comfortable with, and they're going to have to, because the pharmaceutical industry is being disrupted by a lot of competition from smaller biotechs and new modalities, new types of medicine. So it's a slow-moving process because it takes 5 to 10 years to get a drug to market. But eventually there will be a sea change in the way that we treat disease, and primarily it'll be around gene and cell therapy.
All right. So you just mentioned it, and it has definitely come up on a few of our other podcasts, but what are your thoughts on CRISPR technology?
Yeah, CRISPR, it is a very useful research tool, but it's a little overhyped as a therapeutic presently, because it's hard to deliver CRISPR to enough cells in the body to make a difference. And CRISPR protein is a little immunogenic, which makes it even harder. So it's really useful for engineering cells outside of the body, like, for example, FDA and EMA, MHRA in the UK approved a gene therapy ex vivo HSC product for sickle cell anemia. So sickle cell anemia, it's a terrible disease, affects children, it's very painful. And there was recent approval for therapy that's quite straightforward. You take the HSCs out, you CRISPR engineer out the mutated gene, and then you put them back in, and it restores function of their red blood cells. So this kind of logic can apply to a lot of different diseases of the blood, targeting bone marrow stem cells. And so our technology at ImmuneAge for the massive expansion of HSCs and rejuvenation of each HSCs dovetails quite nicely with the ex vivo engineering that CRISPR is enabling.
We've talked big pharma. You mentioned Peter Thiel. There's definitely been some big players that have come into the longevity space or entered it a while ago. Can you share some of the recent developments that you've come across from some of the other known players, such as like Google Calico, Altos Labs, Cambrian Biopharma?
Sure, yeah. So a lot of the smartest cookies in the world are investing in the space. Thiel has been investing in it for probably 20 years now. He was one of the first donors to the SENS Foundation, run by Aubrey de Grey, the gentleman with the long beard who gave me my first research grant back in the day. And since a lot of others have gotten involved, so let's see, Vitalik Buterin, who's the inventor of Ethereum cryptocurrency, the second largest cryptocurrency,
Yep.
is investing in the space. He organized a 2-month series of conferences that we were all attending in Montenegro recently. A similar one occurred in Vitalia in the Caribbean, where we had a series of conferences and invited a lot of the leading thinkers in the space. Balaji Srinivasan is another prominent character in this space, in the space of sort of new organizational structures, new political government structures that would enable faster technological development. You've got some famous Wall Street folks like Stanley Druckenmiller, who's invested in the space. You have Mike Novogratz, also an investor in Cambrian, for example. So there are really a lot of prominent people investing in the space. And so, I think it's just a matter of time before longevity becomes, a household discussion topic over the dinner table, because a lot of the gains that we've gotten from the current medical approach are petering out. We're not getting the same amount of gains that we used to, and so we need to take a totally new approach. You brought up Calico and Altos. Those are notable because there's some of the largest financings in history for any kind of startup company. Altos Labs raised initially $3 billion. Rumor has it they have $10 billion lined up, tranched and waiting from Yuri Milner and a lot of other very prominent investors, Bob Nelson from Arch Ventures, and Jeff Bezos of Amazon, et cetera. Mm-hmm. And backing of the Rockefeller Foundation for Altos. And they've hired a lot of top scientists in the space. They're quite secretive. Another group that's quite secretive, and also based on that Bell Labs model, is Calico. So Calico started maybe about 10 years ago now, also with about $3 billion in funding from Google. It's a subsidiary of Google, or Alphabet today. And they also hired a lot of prominent folks. And their CEO is Arthur Levinson. And Art Levinson is the former CEO of Genentech. He was the CEO that's credited with really building Genentech into what it is today. And Genentech has quite an interesting story because it started back in the 80s and 90s. It started the biotech revolution of genetically engineering organisms like microbes to produce biologic drugs like insulin or various peptides or antibodies. And now most of the best-selling drugs today are actually biologic drugs that were made possible from the biotech revolution. So in the same way that Genentech really opened the door to the entire biotech sector, the CEO of Genentech is now running a longevity company. And so I think all of this portends that, in the next decade or two, longevity is going to become a major theme. Hopefully, people talking about as much as they're talking about AI today, I think the applications to human health are just as significant. And the productivity gains from people being healthier and living longer are substantial. So I can discuss that in the demographic aging crisis. So just to kind of reveal some bad news, we have a global demographic aging crisis. It's called the silver tsunami. Populations are getting older, having fewer children. And so governments are not situated to pay for this because they're structured like pyramid schemes, expecting more people to come in than go out and pay taxes, et cetera.
Oh my God, life is like a pyramid scheme?
Yeah, well, the government
I've never thought of it that way, but you're right. I mean, that's how we're all going to get Social Security or not, right?
Pretty much, yeah, a pyramid or a Ponzi scheme.
Or not.
Yeah.
Yeah, I was just reading, there was this Goldman report about how by 2034, Social Security will not have enough money to make meet its obligations. Mm-hmm. Well, we might be able to help with that by making people healthier, which means we spend less money on medical care, that most of which doesn't really even work. 20% of GDP today in America goes to medical care, and it's mostly sort of palliative symptom treatment. But the other factor is the global demographic aging crisis. The populations are getting really old and not having kids. And so if we do not enable people to be productive for longer later in life, right, if they so choose to be, then the government budgets are going to come under a lot of pressure, and you'll see a lot of inflation and disruption. So we're trying to mitigate that, what's called silver tsunami demographic aging crisis. And one reason I'm sort of trying to get people to be more aware of this a lot of people are concerned about crises like international war or nuclear exchange or climate change, things like this. Those are not 100% guaranteed to happen in the way that the demographic aging crisis is. So economists say demography is destiny. At the present time, there's nothing we can do to change the number of, 20-year-olds we have hitting the job market. There's nothing we can do about that right now. It's baked into cake. So we know with 100% certainty what the population pyramid more or less is going to look like, and we know that it's not going to be good for the current structure. So hence why it's pretty urgent to improve human health, take some of the pressure off government budgets, allow people to work a little longer or work more productively. And one example I give is what if we had geniuses like Einstein or Tesla or von Neumann living another 20, 30, 50,
Right.
100 years in good health.
What could they have thought and what could they have invented? And yeah.
Exactly.
That's a really interesting way to think about it. As part of this, the silver tsunami and, making sure that there are people who are, living longer, healthier lives, but also able to be more productive. Are you a proponent of the decentralization of science? I mean, we work with, and I'm saying this from the psychedelic science side of it, MAPS, which is a public benefit or a nonprofit, but a big proponent of open science, open books, to help everybody. Is that something that you think is key to mitigating this silver tsunami?
Yeah, I'm very strong supporter of psychedelics and related medicines. And some of my friends at Vine Ventures helped lead the recent financing for MAPS.
Yep.
And so,
We know
yeah,
them.
huge fan. And so yeah, that will help with the mental health crisis. And mental health plays into physical health. If you're happier, you're making better health decisions across the board. So yeah, big fan. It's been a long time coming. But I think there's only so far you can get with the ideal psychological state, whatever that ends up being. Aging will still carry on, and so I think they're complementary. And actually, it's funny. A lot of the psychedelics investors, they're kind of realizing, well, psychedelics, it's kind of a little bit reached maturity, and there's a lot of competition in the space. So now a lot of them are pivoting into longevity, so that can be a positive tailwind for the field.
I mean, there's a lot of overlap, though, too, and seeing kind of the advancing of psychedelic science and,
Well, on that point, yeah, so I think there's a strong parallel in the sense that the science for psychedelics has been known for half a century or more or longer or thousands of years for traditional uses.
Right.
And similarly, the science of longevity has been building for half a century as well. And yet both areas were neglected by one, because of government prohibitions, and the other just because it was seen as unfashionable or overpromising. And for a long time, we didn't have the detailed technical molecular biochemical understanding of the aging process that we now have. And so it's almost like you hold like a volleyball or like a ball under the water, and you hold the lower under the water you hold it, the more force it will pop up with. And it's the same with both of these areas. And crypto is another. I mean, crypto, psychedelics, longevity, and the new network state startup cities movement, which we'll probably start hearing about in the next decade. These are all areas, ideas whose time has come, and that the technical capabilities have been in place for a long time. And so once the general investing world and general public realizes it, there's a rush, and it seems to happen really quickly. But it seems like an overnight success. But these things, they're 20, 30-year overnight successes in reality.
We've talked internally about some of the current headlines that we see out there in the media, in particular, wealthy individuals who are trying to find a cure for aging, whether it's through strict diets or blood transfusions or sleeping 3 hours a day, whatever.
Blood transfusions from their sons.
Yes, exactly. So are these individuals, are they charlatans or are they onto something? And if they're onto something, how am I getting involved at a lower price point?
For sure, yeah.
Because I'm not spending
Well,
2 million bucks a year to reverse
sure,
aging.
yeah. So one person who's been in the news lately is a friend of mine, Brian Johnson, and he was at the
Yep.
Vitalia conference that I helped organize, and yeah, he's actually quite rigorous scientifically. He likes to be a little provocative, just because that's the way you get clicks and attention in the modern world, and he's an expert at that for sure.
Mhm.
But I know his doctor, and there's a lot of rigor behind what he does. I have some disagreements, minor disagreements on his approach, um, but there are an increasing number of people who are biohackers or just really focusing on their health and well-being. And if you think about it, your day-to-day experience is highly driven by your health, for me, sleep quality, things like that. So why not invest in that, right? It makes a lot of sense. So that's kind of the new trend of investing heavily in wellness, because it is an investment. You perform better, you're nicer, life is better across the board, as opposed to just buying some trinkets or something.
Right.
And so the
But he's
blood
spending a lot of money though on his like his yearly
Like $2 million a year,
2
right?
million bucks a year is what he's spending on
Yeah.
himself, right? Yeah.
Well, that was to some extent a marketing thing where that got a lot of press attention because it's a large amount for anyone to spend in any given year.
Right.
But he himself says that probably 90% of the gains, the benefits, are from stuff that's cheap or free. Going to bed early, keeping your bedroom cool and dark. Getting what he's really on about is getting in control of our self-destructive habits and addictions. So we all have them. I'm addicted to news and email and staying up late, reading things or whatever. People have addictions to all kinds of things. And we're mostly aware of those. And it's just a matter of the discipline. And what he did was he kind of took all of these individual decisions out of his own hands and automated a lot of the decision making. So, but yeah, he's just one of many who've been doing this, and sometimes fairly extreme stuff, caloric restriction, intermittent fasting, various diets, and there are benefits to those. But my perspective is we should be doing stuff that is healthy within reason, within whatever our budgets allow. But even with the perfect, most ascetic diet and lifestyle, whether it looks like what Brian Johnson is doing or others, um, that will probably only extend our lifespan by 10, maybe 20%, something like that, which we see in the animals. When you do hardcore caloric restriction, 30% caloric restriction, you get about 30% lifespan extension, but there are some downsides.
You're miserable and hungry.
Hungry.
Yeah,
Hungry.
there may be a way to. So if you do intermittent fasting, you can actually you're not that hungry. Or if you eat more ketogenic foods, sort of more fat and less carbs, you're actually not that hungry. But yes, these fully calorically restricted mice, when they're on 30% caloric restriction for their whole life, their body temperature is lower. They probably are hangry, crankier, et cetera. But it's actually been done with the monkeys too, and they look amazing. They really are aging at a slower rate, but it's hard to implement that. That's one reason why the first company that I founded, Samsara Therapeutics in Oxford, England, is the first platform company for autophagy enhancement. So autophagy happens when you do fasting and exercise. It's when the cells break down their internal components and then rebuild them. It's a recycling mechanism. And in 2016, there was a Nobel Prize awarded for autophagy. And so what if we had a pill that would it would grant us many of the benefits of fasting without actually having to fast? And it is possible in the animals. So we're going into the clinic in neurodegenerative disease this year. So anyway, you can get, fairly far with diet and lifestyle. There's still a lot of work to be done in understanding what's the ideal situation. But we're really thinking about the next step, which is assuming you have your diet and lifestyle relatively dialed in, what's next? So we're talking about gene therapies, cell therapies, things that will add decades to life or, eventually centuries to life. Because I'll let you in on a little secret. Physical immortality, biological immortality is already possible. And on a cellular level, it's been happening for, billion years since the dawn of life on this planet, because every cell gives rise to another cell. And so those cells are passed down through an unbroken lineage all the way back to the dawn of life on this planet. And we know this in sexually reproducing species like humans. It's called the germ cell and germline immortality. And this has been known for 200 years plus and discussed widely. When you fuse the sperm and egg cell, these come from adult humans that are aged, 30 years old or whatever. They always create a baby that is brand new 100% of the time, right? So it's possible to conserve immortality throughout the unbroken lineage of the germline. There are even some organisms, simple organisms, some aquatic organisms like a hydra that are technically immortal. And so on a physical cellular level, it's possible. And then there was a Nobel Prize some years ago to Shinya Yamanaka and John Gurdon for reprogramming. So this new technology called induced pluripotent stem cells allows you to basically create embryonic stem cells like you would get from a growing embryo. You can derive them from yourself, say from your skin cells. So you take some skin cells, you put them in a petri dish, you treat them with 4 genes called Yamanaka factors, and it resets the epigenetic age, the biological clock, to a day 0 embryonic stem cell-like state. And so, therefore, we have the genetic molecular capability of resetting the biological age of cells. And humans are just agglomerations of cells, ultimately. And so if we can figure out how to deliver those genes or that engineering challenge, we should be able to reset the aging clock. And so that's one of the things that spurred the launch of Altos and many other companies in the reprogramming space today.
It's fascinating to hear. You talk about these, immortal cells, and I remember reading the book on Henrietta Lacks and the HeLa cells and her line of cells that are still, I think, being used today. Is that along the lines of the same principle that this has been going on? We just don't really think of it as an immortal entity.
Yeah.
By the way, this is Anne's favorite book of all time. She's been waiting this whole series to bring this up.
Not my favorite book of all time, but I'm a big nerd, and
it's up there.
Yeah, it's up there.
Yeah. For me, it's Eat, Pray, Love. So I get it.
I love that one too. I haven't
read it, but that's a common favorite. I could have said 50 Shades of Grey, but it is a PG-13.
No, I'm not with you there. 50 or Eat, Pray, Love. Yeah, tell me more about it.
I haven't read that either. But anyway, so The Immortal Life of Henrietta Lacks is a classic, and there's also another good one called the Emperor of All Maladies.
Yes.
About cancer by Siddhartha Mukherjee, and so Henrietta Lacks, she was a ovarian cancer patient back, I think, in the 50s or something, and they took a sample, a biopsy of her tumor, and cultured it in the lab. You can culture cancer cells because cancer cells can divide indefinitely. They're somewhat immortal, but then she passed away, and this cell line has been used and studied by researchers all over the world for many decades, and there was some discussion with her family about, should they receive some kind of compensation for the use of this cell.
Well, they didn't know that it had been given and that they were kind of in the dark about that. She never knew about it. And there was like that issue of, plus she was a Black woman. And so I think there was also that issue of, what's the ethical implication here of, not having this go on for decades of scientific, profit, right? And them not really knowing or having that much information about what had actually happened too. So I think that was an interesting part of the story.
It is. Yeah. It's super interesting. All of these kind of ethical and business questions.
Yeah.
With all the companies that you're working with or speaking to or reading about, what are some of the more interesting studies that you're seeing out there in the longevity space?
Name your favorite children is really what Phil's saying.
As an investor, I'm wondering.
Yeah, well, there's so many. It's hard to choose, but you actually earlier mentioned the blood transfusion aspect, which has caught a lot of public attention. So if you surgically link the circulatory system of a young and an old mouse, the old mouse gets a little younger and the young mouse gets quite a bit older. So seems to be primarily bad stuff in the old blood rather than good stuff in the young blood. Irina Conboy at Berkeley has really pioneered this work in Tom Miranda's lab at Stanford, and that's her position. So basically, taking young plasma from younger people probably won't benefit you too much. In fact, it's probably not worth the risk of if you're not doing quality control for potential infectious agents or something. But removing some of the damaging molecules that accumulate in the old blood is very promising. And actually, there's an area called plasmapheresis, which is kind of like modern day bloodletting, actually, where you just kind of remove a lot of the blood plasma and you replace it with salt water and albumin. And that has pretty significant therapeutic benefits. So there was a phase 2 study in Alzheimer's disease a couple of years ago in Spain by a company called Alcahest as their partner. The other company is called Grifols. And they got pretty compelling results in an Alzheimer's study just with simple plasmapheresis, removing some of your plasma, replacing it with salt water. So you're diluting out some of these deleterious factors in the blood. And that's the kind of thing where it's tough to get the large pharma industry interested because you can't really get a clear patent position and monopolize the sale of that product for a period of time. But it's the kind of thing that clinical practitioners can already put into practice today. And at a lot of these clinics doing regenerative medicine, plasmapheresis is becoming available, the dilution stuff. But there's also very promising work in stem cell therapy, not just hematopoietic stem cells, which I mentioned, which create your immune system, but there are a lot of different stem cell types, but one stem cell type I like a lot is mesenchymal stem cells, or MSCs. And MSCs, if somebody tells you, hey, I got stem cells for my joint injury, and it, what worked or didn't work, they're usually talking about MSCs. MSCs can be derived from your fat through a simple liposuction-like procedure, or from your bone marrow from a pretty simple, small thin needle aspiration. Takes about 15 minutes. And I know a lot of people personally who have actually gotten significant benefit from chronic problems of their joints, of their spinal disc, various other conditions from MSC cell therapy. So one gentleman I know, he's an avid surfer. He, for many years, had the significant pain in his shoulders, injuries in his shoulders from surfing. And he got one shot of umbilical cord-derived MSCs, and it went away permanently, at least some years, maybe 5 years hence, it's still resolved. And so I've heard several stories like that, and it lines up with the clinical research. So there are hundreds of clinical trials going on with MSCs and related stem cells for many different indications and applications. And so that's an area we're quite bullish on.
I'm sorry, I didn't mean to interrupt, but weren't NBA players doing this too? Like, I feel like it's like Kobe Bryant back in the day, was going to Germany to get shots in his knees. Like, this is the same thing, right?
Exactly. So in Germany, Switzerland, in Prospera, a center where we work with, that we work with in the Caribbean, and many other places outside the United States, it's easier to work with stem cell therapies because the United States has certain restrictions on their use, the expansion ex vivo of MSCs, for example. So yeah, a lot of athletes, professional fighters, and people who sustain a lot of injuries, they get stem cells, exosomes, stem cell secretome, a lot of these products that many of which work, but you also have to be careful who you go to because there are a lot of sort of cowboy doctors out there that are not very sophisticated or rigorous. So this is one of the things that we're aiming to do through Healthspan Capital and our other co-investors is invest in very high quality stem cell products and clinics that have very high standard for their work. And but longer term, over the next decade or two, I think it's going to be very common to get stem cell therapies, particularly for musculoskeletal conditions, joints and related issues.
Is there anything else you want to plug on Prospera 2024? You just mentioned it. What is it? Where is it?
Yeah.
And can Ann and I attend?
Yeah, for sure. You're definitely welcome. And so to step back a little bit, there's sort of a political, social movement dimension to longevity. So a lot of people are, concerned that there's not enough, myself included, not enough attention going to longevity, regenerative medicine as there should be. And part of that is because certain government regulations make it difficult to innovate and compete with the incumbent organizations, and that's by design. So what if we had new jurisdictions where we could advance the pace of medical progress and also other areas of technology, from alternative energy sources to alternative transportation methods, heavily regulated industries within the US and Europe, where that's a barrier to the pace of progress. And so one of these locations in the startup cities neo-governance movement is called Prospera. And Prospera is in Roatan Island in the Caribbean. It's off the coast of Honduras. And Prospera has raised significant capital from prominent investors, Peter Thiel, Balaji, Naval Ravikant, Joe Lonsdale, many smart cookies like that, because they have some level of autonomy and control over their civil code, so their business regulations, for example. And that allows, for example, much faster development of new medicines and new technologies. And so Prospera hosted an event called Vitalia, which is still ongoing, actually. It was a 2-month pop-up city gathering in which we invited the leading figures in longevity, regenerative medicine, AI research, Web3 and crypto, neo-governance, startup cities, to all come together and kind of cross-pollinate ideas, to invest with each other, and launch new companies. And it was super successful. It was organized pretty short notice, and we got some of the top people in the field to come. And so we will be doing a series of conferences regularly in Prospera. I think it will become a major hub for, so-called global Silicon Valley to congregate. And people are living there full time in these beautiful new developments. And so, global Silicon Valley is this concept where a lot of the leading figures were in one place in the Bay Area for a long time, but now they're going all over the place, and the rest of the world is coming online. China, India, Latin America, Eastern Europe, they have their own Silicon Valley types. And we would like to congregate in certain places and go to places where we're treated nicely by the governments, because we're entering a future of increased mobility and decreasing nationalism, particularly ethno-nationalism, and so in much of the world. So people will migrate to the places where they're treated well. So a lot of people will migrate to Singapore or Dubai or Prospera or Miami or Austin, Texas, these places where it's fashionable to move and where you can actually build businesses more easily. And so that's just going to increase. And so Prospera is holding a series of conferences on this topic. So stay tuned for more. And check out the work of my colleague, Nicholas Anzinger, who runs Infinitive Fund. And he publishes a great Substack, Stranded Technologies, it's called, and the Stranded Technologies podcast, which is one of my favorite podcasts in the world. And I listen to a lot of podcasts. So it's a really great one about cutting edge technology and how it's being held back by a lot of government red tape.
So speaking of your media habits and how you are consuming information, you mentioned stranded technology. How else are you, feeding the beast, or feeding your addiction of news and information? And, where are you getting, the lion's share of your longevity updates? Like the whole point is, we're doing this to create curiosity and to, have this be the start of the discussion. And we also want to be sure that we're giving people resources to go to find more. So we'll put links in the show notes, but, are there any books that are must read? Are there any other podcasts you're listening to? Any papers that are important that you think have gone kind of under noticed?
Yeah, absolutely. So I've actually given some public presentations about some of these resources. So if you just Google my name in YouTube, you should find a couple of them. And I actually have several slides on some of the great newsletters, podcasts, books, and all these resources. One resource you can check out is from one of my partners at Healthspan Capital, Nathan Cheng. LongevityList.com keeps track of the capital and companies and investors in the space, and his newsletter, Longevity Market Cap newsletter. And LPs, investors in Healthspan Capital, you can check out our website and invest via AngelList, and you receive regular updates on the latest and greatest in the field. And so I would recommend just checking out some of my previous stuff on what are the many resources in the field. And yeah, we'd love you to get involved. You don't have to be a scientist by training. The more the merrier. I mean, this really is a political social movement.
Right.
We're trying to sort of save our own lives, the lives of our loved ones, and it's heavily neglected by governments, and the established industry doesn't have much incentive to innovate. So we really need people to have that sort of activist mentality and support us. And another movement you can join is called Vitalism. Vitalism is launched by my colleagues Nathan Cheng and Adam Gries, and it's a political movement to get people working on longevity, and recognize, that if disease and aging are bad, then life and health are good, and so we should prioritize our government budgets and investor budgets and our time to recognize that, instead of just accumulating wealth, which is kind of pointless beyond a certain point. We should really be prioritizing health, mental and physical. And so the Vitalism movement, you can check out the website vitalism.io. We're doing a conference in Europe in about a month, and so yeah, feel free to get involved.
Just a question on Healthspan Capital. Are you guys raising additional funds now, or?
Yeah, sure. So Healthspan Capital, we're raising every quarter. We have sort of an evergreen rolling fund structure via AngelList. And so part of the reason for that is we want to open it up widely. So I think the minimum check size is 5K or so. And yeah, so we're always happy to have additional investors investing alongside of us. It really started with me and my two partners, Michael and Nathan, investing our own capital in the space. And there was no traditional venture fund investing in these companies. There was funds like Apollo Health Ventures, which I was one of the earliest employees and helped launch. But that's more of a company builder model. It's quite a sophisticated group, but it's hard for retail investors to get exposure. The check size are large, and they focus on building a small number of companies, whereas we're focused more on supporting a larger ecosystem, writing a lot of checks to existing early stage companies. So it really started with us wanting to invest our own money, and then some friends and colleagues invest alongside us too. So yeah, check out our website, healthspancapital.vc, and yeah, happy to share more info.
Is there, throughout your career and your extensive research and access to some of these great minds, including yours, how has it changed the way you live your life, or any behaviors or anything that that you are doing now, maybe other than diet and exercise and sleep, that you find to be helpful?
As far as my own sort of protocol, I have a document of probably 5 pages or so of stuff that, I share with friends, not medical advice, but just some of the stuff that I think has the strongest evidence. I think the foundational stuff that's fairly obvious, it has the largest benefits. Sleep, diet. I tend to do kind of a lower carb paleo type diet, although I'm not very strict about it, traveling a lot. But yeah, sleep, diet, stress management. I do yoga a lot. All of that seems to make a big difference for me. And then, a lot of people are, one thing that I would say is a lot of people are experimenting with very experimental interventions. So, human growth hormone, hormone replacement therapy, various strange peptides from Russia, that kind of thing. And if you're optimizing for short-term benefits, fine. But if you're playing the long game, some of these are probably bad for you long-term. Human growth hormone is a very obvious example. HGH, yeah, it'll increase muscle mass, bone density, and energy, et cetera, in the short term, but HGH can also drive cancer growth. And one of the first genes that was ever discovered to regulate the aging process systemically by groups like Cynthia Kenyon at UCSF in the 90s is a receptor for growth hormone. And actually, if you reduce the growth hormone activity, you live longer and age slower. There's even a population of people in, I believe, Nicaragua, who have a congenital mutation, a loss of function in the growth hormone receptor. And they're dwarves, they're short stature, but they never get cancer. And so it's and pharma tried to drug the growth hormone receptor for a long time because of that and other evidence. So when people say to me, oh yeah, I'm super into longevity, I'm taking human growth hormone, my doctor's pumping me full of steroids as well, I'm all about longevity, I say, hold on a minute, that's it's not exactly what we're thinking of when we say longevity. But yeah, there are a lot of interesting therapies, supplements, experimental therapies in clinical development that probably extend lifespan. One that has a pretty strong evidence base is rapamycin. Rapamycin is widely consumed. It's a FDA-approved pharmaceutical used for various applications, and in a low dose, it seems to slow the aging process across species. One of our advisors to the fund is Matt Kaberlin, who's probably the world expert in mTOR and rapamycin biology, and he takes rapamycin himself. He's not shy about it, but he's very rigorous in his thinking, generally speaking. So yeah, that's one tip to not medical advice, but you and your doctor may want to look into rapamycin in the research around rapamycin.
Sebastian, thank you so much. I know that you have to run. You've been really generous. We appreciate all your time. You can go ahead and hop.
Yeah, absolute pleasure. Thanks, guys. Talk to you soon.
Thanks, Sebastian.
Bye.